Researchers have known for several years that when you supplement multiple vitamins in patients with HIV, that these patients did very well and actually increased their CD4 white counts. Now, CD4 white cells are the particular white cell that is significantly destroyed in HIV infections or in AIDS. However, these studies were done primarily with individuals who either had severe HIV illness or were pregnant. A more recent clinical trial was reported in the November 27, 2013 issue of the JAMA, or the Journal of the American Medical Association. The difference in this study was the fact that they supplemented a multiple vitamin along with selenium in individuals who had early HIV infection. This study was conducted using individuals who were infected with the HIV subtype C, which is a much more aggressive form of HIV infection. This particular study involved 878 patients from Botswana who were infected with a HIV subtype C and having a CD4 count above 350. When the CD4 white count dropped below 250, these patients were started on a combination medical therapy called ARIIX. These individuals were followed for 24 months and divided into 4 groups. There was the placebo group, a group that just received selenium, a group that received just a multiple vitamin, and a group that received both selenium and a multiple vitamin. The multiple vitamin plus selenium group was the only group that showed a significant decrease in the number of HIV-infected individuals who dropped their CD4 count below 250. In fact, there was nearly a 45 to 50% decrease in the number of individuals who dropped their CD4 white count to this level compared to the placebo group. Also, the multiple vitamin plus selenium group significantly decreased the risk of having a serious event due to their HIV infection. Now, it must be pointed out that the multiple vitamin alone group and the selenium group alone did not show a significant decreased risk when compared to the placebo group. Now, I find it interesting that in this study, they only used 200 micrograms of selenium, and a multiple vitamin consisted of thiamine, 20 milligrams, riboflavin, 20 milligrams, niacin, just 100 milligrams, vitamin B6, 25 milligrams, vitamin B12, 50 micrograms, folic acid, 80 micrograms, vitamin C, only 500 milligrams, and vitamin E, only 45 international units. Now, if you don't understand that, this is a very modest supplement, to say the least. This is a significant study that has appeared in a mainstream journal, the JAMA. It is a well-done study that has broad implications. Any individual who is diagnosed with HIV infection needs to be encouraged to start an aggressive nutritional supplementation program immediately. This will allow them the best chance of delaying or maybe even preventing the need of having to take medication that is only indicated once the disease has progressed to its latest stages. In fact, this study reviewed several studies that showed nutritional supplementation was very effective in this situation. Now, personally, I would recommend even more aggressive nutritional supplementation than was provided in this study. I would recommend that all these individuals take what I refer to as cellular nutrition, which provides a much higher level of supplementation that is still safe and includes 200 micrograms of selenium. I would also add additional enhancers that are known to significantly boost your body's natural immune system, like CoQ10, higher levels of vitamin D, and grapeseed extract. Now, my last thought is the fact that if nutritional supplementation is effective in improving the immune system of an individual who's already infected with HIV, how much more would an individual respond who was in good health?